How long has artificial disc replacement surgery been available to patients in the United States?
Since approximately 2004. In 2004, the first lumbar replacement was FDA approved. We looked at that, your spinal team, the members of your spinal team looked at that prosthesis, and it was not the prosthesis that we decided to use. It was a very exacting prosthesis, and there were some issues regarding implantation and how the certain patient limitations. We basically waited until the second generation came out, which we believe is a safer prosthesis, and that it's a safer implant, less likely to cause problems. And to be quite frank, I'm glad that we waited. We've had a minimum of complications with this prosthesis, and overall our results are really good.
Explain to the layman an artificial disc prosthesis as it would relate to a knee replacement or hip replacement.
Well, knee and hip replacements were an advancement over knee fusions and hip fusions. Back in the 1950s and 1960s, if a patient had severe arthritis of a joint, of a knee or a hip, they would get a knee fusion or hip fusion. And those were excellent operations in that they relieve pain. However, with a stiff knee or a stiff hip, it's hard to get in and out of a chair, hard to go up and down stairs, hard to get in and out of your car, very difficult for personal hygiene. In the 1960s, hip replacements evolved, followed by knee replacements, and now they're commonplace. The major issue between hip and knee replacements and disc replacements for the spine are that hip and knee replacements are intended for the senior citizen. The major difference between hip and knee replacements and disc replacements are that hip and knee replacements were designed for the senior citizen. Disc replacements are designed more for the young, active person. If you look at the original intent of hip and knee replacements, they were for patients that were over 65 years of age. Disc replacements for the neck, the cervical spine, or the lumbar spine were from patients between 20 and 60 years. So the intention of a disc replacement is to get the patient back to vigorous activity, such as work and sports.
Let's talk about the patient that's had fusion versus the patient that's had artificial disc replacement and the end result. Specifically, I want you to get into the stiffness piece.
Yeah, well, as I said, a fusion procedure is a good procedure for a patient that's severely disabled and almost to the point that they're housebound or community bound. They can't. They're in such pain that they really can't get by at all. A disc replacement and the spinal fusion does help those patients. However, it's limited. Perhaps they'll have 50, 60, or 70% of their improvement. Part of the problem that we deal with spinal fusions, is that a phenomenon called adjacent segment deterioration can occur, which means that the disc above or below the fusion has to take up the stress of the fused level. So, as an example, in the lumbar spine, there's 5 discs. If 2 of them are fused, that means that the other 3 have to do the work of 5, and they wear out faster than they normally would. If they wear out, they may need another operation. Now, that other operation used to be doing a spinal fusion. So you'd add to the spinal fusion. With a disc replacement, in select patients, we can now offer them a disc replacement next to the spinal fusion, which gives them motion and relieves their pain. In the patient that is a candidate for a disc replacement, not a fusion, just a disc replacement, those patients in general can go back to more normal activities. Some of them can go back to very high degrees of physical activity afterwards. Sports, volleyball, golf, soccer, running, a number of sports, and heavy duty labor at work. And there's less of a chance that a patient will need to go on to a second or third surgery after a disc replacement because we don't see that adjacent segment deterioration with disc replacements as often as we did with spinal fusions.
Fusion can leave you stiff, where artificial disc replacement lets you return to normal motion mobility?
Yes. A spinal fusion will render a patient stiff, and it may help their pain, but it takes away their normal motion. Whereas with a disc replacement, not only will we be able to reduce or relieve most or all of the patient's pain, but they can go back to normal motion, which means that they can go back to more normal activities such as lifting, pushing, pulling, twisting. They can return to sports, once again, golfing, volleyball, basketball, bowling, and even high demand sports. There are actually college wrestlers, mixed martial arts competitors that have disc replacements implanted that are back participating.